Hello, everyone, and welcome back to the module. This week, we're talking about an interesting topic. We're looking at diseases of the excretory system, and we're also going to look at the mechanics of this system. So the first lecture, which is the one you're watching right now, we're going to talk about the various diseases of the lungs, the kidneys, and the liver. And then in the next lecture, we'll be talking about the mechanics of the excretory system, looking at its mechanical properties, whether that's the alveoli structure that we're studying, or whether it's the skin, or in general, the mechanical properties of the tissues in these organs. So today's lecture is going to be quite interesting, although it doesn't necessarily mean that for all of these diseases we have a medical treatment that's engineered. In some of the cases, we simply say that there is no treatment, or there are only therapeutic-based treatments. But in some cases, you'll see that there are engineering tools that can be used to tackle these diseases. We're going to start with the human lungs and the respiratory system. So lung disease, I've included three main types of lung disease, the most frequent ones. Mostly they involve the breathing of the breathing capacity and the breathing efficiency of your lungs. And so, as you'll see, all three subcategories that I've listed here somehow involve geometrical changes in these cavities. So the first one that you've definitely heard of is asthma. And in this case, what happens is that the walls of the airways become swollen and they become thicker. As you can see here in this image, this is a healthy lining versus a swollen, sort of thickened lining. And in this case, what happens is that the cavity becomes narrower and you have mucus building up here, which that's what you actually see when you're coughing. In the case of when you have a viral attack or something, you have mucus, and that usually means that you're going to have trouble breathing, and you're going to feel that tightness in your chest. So typically it's again the narrowing of the airways and the swelling that happens there. And it's not always a sort of unlivable thing. You can, and a lot of people live with it and they just use their devices. But for some people, it can actually grow pretty fast and get severe really quick. And so it can be actually quite life-threatening. Unfortunately, asthma doesn't have a cure, but we can control the symptoms, and the individual can live with it in most cases without any problems. The second disease we're talking about is bronchitis. And in the case of bronchitis, what we have is the inflammation of the bronchioles, which we've looked at before. So when you go all the way down in your respiratory system, you have the trachea, then you have the bronchioles. First, you have the bronchus and then the bronchioles. So whether it's the bronchus or the bronchioles, this swelling and inflammation can actually occur in the walls of these structures. And what happens is that you again have mucus accumulation, very similar to asthma. And in this case, this inflammatory response is going to also cause difficulty in breathing and coughing. And again, the most common reason for this is viruses, as you've seen with the COVID situation. But then also smoke and other kinds of irritation can cause bronchitis. So it's also a very common disease. And as I mentioned, it can happen in the bronchus or in the bronchioles, which are the smaller branches, just like we had the arteries and arterioles. And the third type of disease is emphysema. What this refers to is the case where the alveolar structures are getting damaged, and so their walls are starting to get deteriorated and thinned. They lose their structural integrity, and as you can see, in the healthy versus diseased, those walls can now get thinner and thinner and gradually puncture as they collapse. And so what happens is that the efficiency of oxygen exchange, of course, is going to be influenced. The leakage there is going to mean that it's going to gradually get worse and worse as the function of the heart is just going the lung is just going to keep declining. And so they won't be able to really circulate air as efficiently as they could before. So this means that it's going to gradually affect the other regions of the lungs, including the bronchus and the bronchioles, and you're going to get inflammation in those regions following it. So this cascade sort of accelerates really fast. And as you know, the heart and the lung are very important and critical organs in our body. So this is going to grow and expand into the other organs as their efficiency drops, and you'll see other sorts of failure happening in the human body. So that's why you need to figure a solution for this. But a lot of these do not have a cure. So if it's smoking or if it's a viral infection, you have to attack the reason behind it, the sort of the first occurrence, and sort of eliminate the smoking action or fight the virus rather than trying to repair the tissue, which is unfortunately quite impossible. It can repair naturally by itself, but we can't directly repair it without changing it. So in terms of lung disease, another interesting point, which is unfortunate, is that the leading cause of cancer death in the US and also globally, one of the leading causes is lung cancer. So it's a big portion of those basically cancer types that reach severe states is considered to be lung cancer. And what happens is a cascade of events that starts from you breathing those particles, and usually, one of the most common causes is smoking and pollution. What happens is those pollutant particles, as they enter the cavities of the lung, they're going to induce an inflammatory response in the epithelial lining, and it's going to gradually change the phenotype of the cells. And then autophagy is the process in which the cells that are damaged and they split into pieces, cell death happens, and the other cells try and reuse those fractions. And that is actually not good, because in this case, if those are unhealthy fractions and they're consumed by the cells, it will result in more unhealthy cells. The other thing that happens is the DNA damage. Because of that long-term inflammation, it can cause permanent damage to the genetic footprint. And what happens then is that you see either of these events. One is cellular senescence, which is the state of basically sleeping. The cells go to that hibernation state. They no longer function. Even worse, they can actually transform into an unhealthy cancerous cell line and grow in an unhealthy fashion, or they can die, secreting their fractions and then again causing autophagy. So in either of these cases, you start getting deterioration of tissue and most likely, this irregular growth in cancer. So, it's really unfortunate that whether it's just direct smoking or secondhand smoke has such a major influence on your lungs health, but we still have it as a leading cause of death when it comes to various types of cancer. So that sort of summarizes lung diseases. Now we're going to talk a little bit about our kidneys. So it's interesting to know that kidneys, amongst our other organs, they're not influenced necessarily by their own natural decay, Sometimes it's the other organs, and actually the majority of the time. So as you can see here, hypertension, for example, is growing more and more to become the leading cause of kidney failure. So as you can see, the cardiovascular performance or diabetes, okay, the liver performance, the cardiovascular performance, and other organs are now the leading cause of failure in the kidneys. And the kidneys are really that sort of the system that maintains homeostasis and keeps the body going, getting rid of all the waste and stuff. So if you actually put too much load on it, as I showed you in the lecture where we were talking about transplantation, the kidneys are going to take that extra load of the transplanted organs not being fit for the recipient, and therefore after a while they're going to give up, and you have to then replace the kidneys and so on and so forth. So, but apart from that, kidney disease, again, I've picked 4 important and most frequent cases of kidney disease. The first one is infection, and infection is usually caused by bacteria entering the urethra. So what happens here is that the tube that carries urine, which is the urethra, is the same path through which, unfortunately, bacteria can travel through, causing infection in that tract and also up through to the kidneys. And it can attack 1 or 2 of the kidneys, and the infection does require immediate attention. And if you don't use antibiotics and control it, it can go through the bloodstream and infect other regions in the body and other organs. Not much of an engineering solution, again, antibiotics, but the geometrical property changes are quite interesting. So as you can see here, this is a healthy kidney. What happens is you get inflammation in these internal regions, and that causes atrophy and change in the thickness of the kidney walls in the cortex. And then scarring gradually happens when you get this thinning and damage extending through. You start to get such a significant damage that scarring happens, and the cells try and repair the scar tissue. So you get the immune response, you get the epithelial cells and other cells types involved in the repair mechanisms. And because this is just growing to get worse and worse, the scarring just gets more severe. And so you get a completely different mechanical performance in the kidney, and it gradually becomes this wrinkled structure that is no longer capable of having the same exchange properties as before. Another common kidney disease is kidney stones, and these stones can be a few millimeters in dimension, which makes it really hard to remove through the urinary tract, as it's just also a few millimeters in diameter. And what happens is usually it's those salts and uric acid that start to crystallize and gradually block the passage of urine. These products usually are there because you have irregular amounts of these minerals forming there, or you don't consume enough fluids to circulate them, and they become more concentrated and dense, and it hurts a lot, actually. So you can also have other medical conditions that are synergistic with this and cause it. But actually, this one is one that has a couple of different engineering tools to tackle it. One is actually ureteroscopy, and the case here is you use a ureteroscope to go through the urethra and then travel through the bladder to sort of deploy this basket-like tool here and capture that stone. And with that, before it causes more damage and irregular behavior here, which is also going to be happening concurrent with the pain, you actually remove it from that area, And you can actually bring this basket, retract it into that shell so that as it travels through, it doesn't damage the wall of the ureter. And so this is one process. Again, it's not really going to damage the patient's tissue. It just goes through the urethra. Another case is shockwave lithotripsy. In this case, you're using waves. You're using those ultrasound waves to break down the kidney stone into smaller kidney stones, which can then be removed through the ureter and circulated through. And so this is actually a common treatment when the kidney stone is too large, and it's again non-invasive, and it's basically outpatient, so it doesn't damage the patient throughout the process. Whereas this one, percutaneous nephrolithomy or nephrolithotomy, is actually the case where you're using probes that poke through the skin, so you have to make incisions. And in this case, you have 4 probes, and what they do is they go in there and they actually, one probe is there to clip the vessels and the other does the cutting with a scissor-like incision tool inside the body and removes the kidney, or in this case, it's just used to deploy the tools and then remove the kidney stones to make the proper incision, and then remove the kidney stone from that region. But it's actually interestingly also used to remove the entire kidney, and that procedure is pretty interesting. If you search YouTube for that, you'll see some good animations showing how they clip the circulation away, and then they actually detach the kidney and remove it using the basket. So this process is very similar to laparoscopic and robotic surgery, where you have the probe poking through the skin and doing the surgical process. We're not going to go over the last one, but basically it's similar. It's an intra-abdominal procedure that goes through and uses robotic tools to do this. This process also is done nowadays using robots. The other case is general kidney disease and chronic kidney disease, where it goes through various stages to get worse as a function of diabetes, which is a long-term condition, of course, and infections that are not handled well, or chemical poisoning. And as you can see here, it starts with a healthy, normally functioning kidney, but it gradually loses its function until it fully fails. And you can see here that a polycystic kidney, and the reason these cysts grow is that you have these cells that are starting to, I mean, the inflammatory response is so severe that they start to get more and more unhealthy, and then they are starting to die, but then sometimes they, rather than surfacing and dying and dividing into pieces, in that unhealthy terminal state, they divide, and this division is sort of a cancerous-like division, and they grow into these cysts, which have a huge amount of build-up of watery content, and they can gradually become cancerous, but not in all cases. In some of these cases, you have a healthy cyst that can live with it, and it gradually can absorb. And so there's really, again, not much of a cure for chronic kidney disease, but you can at least stop it from getting worse using treatments. And the typical treatments that the doctors suggest are changing your lifestyle and staying healthy so you don't have those depositions there. You actually want to try and control the root causes, such as blood pressure. As I mentioned, hypertension is one of the main causes for kidney disease, and also your cholesterol level, which influences the cardiovascular performance and the kidneys directly as well. And if it gets worse, dialysis and kidney transplantation, when it's just gone out of control, are the only ways you can handle it. Now, in vitro devices, and I've actually seen interestingly, these devices are now deployed for outer space exploration of kidney disease progression, because some processes, the microgravity accelerates them. And but in general, these chip-based devices that introduce gradients of therapeutics and have they can host various types of cells involved in the kidney, and you can circulate the therapeutics to see the efficiency of those, and also look at the exchange properties of the kidney, and whether it's declining or not in the diseased case by using diseased cells, are now becoming more and more widely used. But still, as I mentioned, we've already talked about these in vitro models extensively. Plastic isn't the best substrate, and hydrogels that are printed have their own challenges. But we are getting better at these, at least understanding what the causes are and what the pathways are in these diseases. Gout's another form of kidney disease. It's a form of arthritis, and you have this excessive production of uric acid building up and depositing these crystals in your joints. And that's how you see this sort of extruded region. So you start getting very severe joint pain, and then something they call big toe. In your big toe, you start getting more and more pain building up, and it gradually grows into your knees and elbows and other joints as well. And so it's basically then going to initiate inflammation, because it's an irregular lesion in your bone cartilage unit, and so it becomes more and more swollen and limits your motion, which can be detrimental to your daily performance. So now we're going to kind of move away from the kidney and its associated diseases and talk a little bit about liver disease. It's interesting to know that the scope of liver disease, because it's the fifth most common cause of death in the UK, but it's also the only major cause of death which is increasing. So this is actually unfortunate, and it's usually a product of use of alcohol or obesity, which are growing in use or in prevalence in today's world, but of course also hepatitis B and C viruses. And in general, it's decreasing in the rest of Europe and globally, but in the UK, unfortunately, it's growing. In terms of liver disease, there are multiple phases. The first phase, which is what we call fatty liver, or NAFLD, is non-alcoholic fatty liver disease, and you just get deposition of fat that causes enlargement of the liver. But gradually, this buildup of fat can, in the long term, cause scar tissue formation, and the broader injury and damage is going to cause more and more scar tissue, and then you're going to go from a regular steatosis, which happens, again, this sort of liver disease happens in 20 to 30% of the population, but that initial case where you just get a little bit of enlargement and steatosis happens in the majority of patients. But NASH, which is the latest stage of it, actually happens when you get a huge amount of scar tissue, and that only happens in 5 to 10% of the kidney disease patients. And it can get even more severe in necrosis, where the scar tissue takes over, and it makes it even harder for the liver to operate until it loses its operational capacity entirely. And so this is, again, when you reach the non-alcoholic steatohepatitis. And so, again, this doesn't happen in a majority of the patients with liver disease, but 5 to 10% of them do see this. As I mentioned, cardiovascular disease and diabetes play an important role in our kidney disease, but also in the liver disease here, first causing NAFLD, which is the non-alcoholic fatty liver disease, and then that progresses to NASH, which is unfortunately the severe case. In terms of how to solve that problem, there aren't that many biomarkers actually. There's no good, let's say, repeatable biomarker test for NASH, which is the severe case of liver disease, but there are ways to monitor it and actually detect it other than biomarkers. And an interesting method here is elastography. And the process here is you can sense the elasticity of the tissue by looking at the wave that you send through the liver and basically the velocity at which it travels and resonates back. So you can actually look at that wave propagation and detect the stiffness of the liver. And it's actually interesting that because the stiffness of the liver correlates with the severity of the disease condition here, as it goes from the early stages to the severe case where it becomes really stiff, you can actually see that various kinds of contributors to this disease are listed here, and the different phases of progression of the liver failure. You can see here that they correlate with liver stiffness, and you can easily sense the progression by just measuring the stiffness and elasticity. So as you can see, the onset of each of these detrimental stages of liver failure can be different for these different causes, alcohol, hepatitis, but based on your measurement of the stiffness and knowing which of these you're looking at, you can see what level of failure you've already arrived at. And so this is an interesting utilization of mechanical properties of tissue in sensing and detecting diseased lesion. Now, again, as I mentioned, of all of these diseases that we've looked at for the lungs, the kidneys, and the liver, very few have biomedical technology-based solutions, but still you can see that mechanics of the tissue and the performance, the mechanical performance of the tissue plays an important role in either the early or latter stages of disease progression. So it's very important to understand these properties. And that's what we're hopefully going to continue doing in the rest of this module, including the next lecture. So until then, let's take a quick break and then we'll meet back in the next lecture. Take care.